Hey everybody, it's Katie Amrine, and I am going to do my video for the reflection post on Yellow Dig. I started out my nursing career on a medical oncology floor. I actually worked as a ward clerk and nurse's aide while I was going to nursing school, and then after graduation I just stayed on the floor I was on. Learned a lot of the basic skills. We took care, at that time we were just opening our first cath lab and starting our open heart program, so we did a ton of pre-open heart patients. We did all the pre and post cath lab patients, so people that were coming back with pacemakers, post stents. So we did a lot of cardiac stuff, a lot of pneumonia, a lot of oncology. So I did chemo and took care of radiation patients. So I learned a ton of really good skills, and I think that's where I fell in love with cardiology and the heart at that time. So after a year and a half on the medical oncology floor, I transferred over to the cardiology clinic, which is where I still work now. And I worked with three physicians and three APRNs, and we're out in western Kansas, so we actually are kind of the hub for the whole western half of the state. So we currently have about 30 places that we've traveled to a month. We've kind of cut that back when we lose providers, and then added some more on when we get some more providers in. But we service a huge patient population. We have a lot of staff. I have over 30 staff members in the clinic that work for me currently. So while I never really considered myself a nurse educator, and I'm just a nurse educator learning, through this course I've realized that, every day in my job I'm teaching people, that I'm continually on a daily basis teaching people, nurses, receptionists, sometimes even the APRNs and the physicians. I'm teaching them about things, whether it's patient care, whether it's, hey, let's go recheck this blood pressure. I'm not sure that, you did it right. Educating about different medications that they run into, that the staff runs into, that they're not familiar with. And I'm getting educated constantly. In my job, I'll have a drug rep come in that has a new medication they want to talk about. Or, we run into a patient with a great murmur that I've never heard that one of the docs or APPs want to come teach us about. So I truly feel that this class has opened up a lot of doors and really made me aware of how in my daily practice I'm still continuing to learn every day, and I help others learn. And that's, I think, truly the meaning of being an educator is being open to new experiences and learning things for yourself, as well as, always being willing to foster and nurture that drive in other people. So I was really interested to read when I read the nurse competencies at the beginning of the course, because I knew that there's a lot of people in the hospital I work in that are certified nurses, but I didn't realize that there were so many broad categories that people could get certified in. So that's actually something I'd really like to look into after this course. It would be getting certified in an area that's pertinent to my interests of cardiology. So thank you guys for your time, and it's been great getting to know everybody and read everybody's posts this far in the class, and be great to just continue to grow with everybody. Thank you.